The last Ebola crisis changed the way African countries, including Nigeria, the way we respond to disease outbreaks. What do you see us doing differently now, from your perspective?
Well, let me just say that the last Ebola outbreak in Nigeria turned on a positive terms Nigeria as a country that can respond to emergencies. And it was basically based on three C's: the unity of command from the president and commander-in-chief, the coordination of the Federal Ministry of Health, which was very effective, and then the commitment of the healthcare providers. I think that made a lot of difference to the disappointment of many countries of the world, because the feeling that good things may never come from Nigeria had failed in this regard. However, I'm sure you want to talk about the issue of this monkeypox and the rest. I think that by and large, I think the response is fairly okay. The only challenge we have is the fact that Nigeria missed the opportunity using the experience of the Ebola outbreak. We propose that at least Nigeria should have a well-equipped lab, public health lab, in each of the 6 geopolitical zones. And if we had, based our success on Ebola on this, I believe that we would have done better. But I think we missed that opportunity because it doesn't appear that there was a effective follow-up to our recommendations. But all things are not lost. At least the Nigerian Center for Disease Control is coordinating very well, and the Federal Ministry of Health, is creating awareness. Basically, one of these things that we'll talk about, which probably is our undoing or something that we really lack, is the issue of awareness creation. People don't listen to us. It's basic. We need to have personal hygiene. You need to have environmental hygiene. But if you look around, our environments are dirty. We do not practice hand washing regularly when we go in or come out. And I think that this is a missing link. We need to sustain public awareness creation.
Okay.
And we use the media. And the media have been very effective, the radio, the televisions. They've been very effective in providing information and education to our people.
Professor, let's move on. Let's talk about, because in the heat of the Ebola crisis, there was a lot of talk about vaccine research and development. We did hear about 1 or 2 companies or so that were developing the vaccine for the Ebola crisis. So, of course, that also shed light on the capacity of African, especially those countries affected in terms of their capacity to develop vaccines for the virus, the capacity of their research institutions. And of course, that also brought Nigeria to the fore. So my question is, where are we in terms of, perhaps starting with the Ebola virus, the vaccine research and development?
Well, thank you very much. As you know, I was the Director General of the Nigerian Institute of Medical Research at the time, and I was a co-chair of the treatment research group on Ebola. But up to the point I left last year, July, there was nothing about vaccine development in Nigeria. As far as I know, I don't know whether it has been resuscitated, but I am not aware that there's any research in areas of vaccine development in Nigeria. But I think it's going on in other parts of the world, in developed countries of the world.
Okay, so my question is, why are we not on that path?
Yeah, I think the inability of Nigeria and those who are in authority to realize the value of research is a problem. And that's one of the greatest challenges we have. Secondly, because they do not appreciate the value of research, and which of course vaccine trial is research, they do not fund, and funding is a big challenge. I must say this. While I was in the institute, I know how much we struggled to get fund, and there's no fund, and without fund you cannot go anywhere.
But it's an institute of medical research. I just imagine that funding will be basic and a given.
Yeah, that is an assumption. Unfortunately, in reality, it is not accorded that priority that we believe we should have, which is given to NIH, the National Institute of Health of America, the MRC of the United Kingdom. We have, the funding is very poor, to say the least. I mean, I'm being mild by that statement, but the funding is very poor. And without funding, we have the capacity. Nigeria has experts. We have experts. I think that the WHO lab in Senegal that we took our monkeypox specimen to, probably you go there, you see many Nigerians. In Europe, in America, you have Nigerians, and all we need to do is to improve on our capacity. We have capacity, we have experts, but I think commitment is where we lag behind. And
I want to believe that the Institute has called, or at least has pressed this on the government over the years, on the importance of funding research. So what has been the response so far, at least while you were DG?
Well, while I was DG, if I made one statement, the second would be funding. Unfortunately, I don't think I got any positive response as far as the desire to fund health research in Nigeria. And I don't think it's only just health research. I think all forms of research. And as you know, research brings about development. The product of research development is as a result of research activity. Even as simple as it is, there are simple things, how well you are doing. You need to monitor how you are doing. That's what we call monitoring and evaluation. It's research. But unfortunately, it appears that we have not bought into the idea.
So when was the last time, sorry, Professor, if I could just come here, when was the last time Nigeria achieved a major medical breakthrough? Well,
Ebola is one, because that is 2014. Because when Ebola came to Nigeria, the feeling of the developed countries of the world and any other person who knew what Nigeria was that Nigeria was in for it. But you know the aggressive nature, and like I said, the political will of the president and commander-in-chief then, and the coordination of the minister then in the Ministry of Health, and then the commitment of healthcare providers. I think that was a great achievement for Nigeria.
Okay, so in terms of product or drug research, drug development, we haven't had any major breakthrough in...
No, there used to be, in the NIPRID, that is Nigerian Institute of Pharmaceutical Research and Development, there was naprisan, that was used for, I don't think it's cure, but to ameliorate sickle cell disease. But I don't know whether that has been developed further. But NIPRID was on the map, on a national world map on the development of naprisan, which was used in the cure of sickle cell disease. But apart from that, unless you really cannot achieve much without funding.
Okay, so if there hasn't been funding, or if there's been inadequate funding on the part of the government, how about the private sector? Have there been any...
Well, unfortunately, the private sector also is not helped. Maybe the enabling environment is not sufficiently created by government, because they need to. Look at the funding for soccer. Everybody runs and donates to soccer, to the stars. But the issue of research for development is actually, it takes a back seat. And it's because it's intangible, because nobody thinks that anything, unless you construct a big building, nobody thinks that there's anything that comes out of research. Research is all about generation of ideas.
Professor, if I could just come here also, does that mean that we don't have any clinical trials going on here in Nigeria?
Whether they have, I do not know. But there are some other form of research going on. It's not only clinical trials. There are other research activities going on. It's just that some of the research activities that are happening now are mundane. The ones that will give us probably Nobel Prizes, I have not seen any going on in Nigeria.
So obviously this will have implications for in terms of how we respond to major diseases, Ebola, for instance. Just recently we had, thankfully there is already a vaccine for yellow fever, but we did see an outbreak recently. So, just looking into the future of medical research, drug development and research. From what you're saying, it looks very bleak. So are you saying that there is nobody on the part of the government, the private sector, the institute, nothing at all that is going to bring about a change in terms of how we take it upon ourselves to research and get ourselves vaccines and even possible cures for diseases that are, known to occur, especially here in Africa?
Well, I think, again, we need to do a lot of advocacy and sensitization. We need to do a lot of advocacy to the private sector, a lot of advocacy to government, to bring back, research into the fore. I think that if we do that, I don't know whether I'm not, as you know, I am no longer the Director General of the Nigerian Institute of Medical Research. I do not know, I don't have details as to what commitment of government at the moment on research, but the much I know, I'm in the university and I know that not much research is going on. So, and you know that one of the primary mandate of the university is research, whether be it in engineering, be it health, be it agriculture and the rest. But we need to be able to move forward. And for us to move forward, research must be key and must be taken to the highest level. And I believe that the government may be doing their best, but as far as I can see, I think their best is not good enough.
And that was Innocent Ujah, former Director General of the Nigeria Institute of Medical Research.